We're here with Everyway Woman, and we have Dr. Justin West from BreastLink. He is the director of breast reconstructive surgery. Thanks for being here, Dr. West.
Thank you for having me.
Now, I'm not sure if I got your title right, so I'll let you tell us about it.
That's absolutely correct. The director of Plastic and Reconstructive Surgery.
Okay. Now, tell us a little bit. Who are candidates for breast reconstruction surgery?
Well, the way I think of it, anyone who's healthy. Essentially, there's very few women that we turn away for reconstruction. You know, any woman who wants to have reconstruction performed, as long as they're a healthy surgical candidate, we talk to them about breast reconstruction.
And what are some of the options, say, after a lumpectomy, something that's not quite as radical?
Yeah, that's an interesting question. You know, years ago we would have said the idea of a lumpectomy versus a mastectomy is to preserve the majority of the breast. So we usually save the nipple and save most of the breast tissue. But we found over time that anywhere from 20 to 30% of people who have a lumpectomy, where you're saving the breast, we're saving a breast that doesn't have a very good shape, or it's not very pretty. So we say, well, we saved the breast technically, but it doesn't look very nice. So a recent advance, or at least one that's gained more popularity recently, is oncoplastic surgery. So onco means cancer, and plastic, of course, we understand plastic surgery. We've combined these two ideas so that when the cancer surgeons go in to do a lumpectomy to save the breast, we often combine a plastic surgery technique. So a common one would be if a woman comes in with a large, heavy breast, and this may be a woman who is thinking about having a breast reduction anyway. If she develops a cancer in that large, heavy breast, she'll see my father or one of the other cancer surgeons, and then they'll often send them to me and say, can we possibly combine a plastic surgery technique with the removal of this cancer? And oftentimes the answer is yes. The benefit is that, number one, we'll often make a nicer looking breast. Number two, we often get a bigger margin. So when we talk about cancer, what we want to do is get a large amount of healthy tissue around that disease so that we leave them disease free. Well, with reductions, we take very large amounts of tissue. So if you combine the two, you get a better cancer surgery oftentimes and a better cosmetic result. And then another benefit is they actually have improved radiation results. It's very hard to radiate a large breast.
So you would go in at the same time,
Yes.
the same surgery. So when the woman is recovering, she's not going to necessarily, she's going to see something that looks a lot nicer, which has got to be really important in the recovery to wake up and, you know, you don't have this big indentation or,
Exactly.
or some dramatic, because I can't even imagine what that would, you know, to go through the process and then all of a sudden have to wake up and part of your body is missing.
Yeah, that's exactly right. I mean, women are, you're given this very tough diagnosis, and it's an emotionally distressful diagnosis. We can put a silver lining on that and let them know that, and it doesn't apply to all women, but there's a good subset of women for whom you can make them look better while you're doing their cancer surgery, and more importantly, get an even better cancer result because you're getting more tissue out from that breast.
So what about reconstructive surgery? Like if you get that and then you're not satisfied with it, what can you do, and how soon after can you do it?
Well, in the setting of a lumpectomy, you know, people frequently will come back and, you know, have something about the result that they're not happy with. You know, initially when a woman has a breast cancer, most of them are just worried about getting through it and being alive. They want to be alive in 5 years and 10 years and 15 years. And the good news, when you diagnose it early, they will be. In terms of from a cosmetic point of view, patients, when they've gotten over the cancer part and they know, okay, I'm going to live through this, I'm going to be okay, then they often take notice of how they look. And they say, well, could I look a little bit better? And so we'll have a conversation sometimes 1 year or 3 years or 5 years after a cancer surgery. Ideally, you know, in those patients, lumpectomy patients tend to get radiation. So we generally want to operate on them before they get radiation because there's some complications associated with operating on somebody who's had radiation therapy. So in an ideal world, you would see the plastic surgeon at the time of the diagnosis. In a lot of centers, that's not possible. A lot of centers are either you have doctors that are independent, you have a surgeon in one building and their oncologist is in another building and their plastic surgeon is down the street. The nice thing about a system like ours is we're all under one roof. I can be at my desk working on notes and a new cancer patient might come in. My father or Dr. Kapoor would come in and say, we've got a new cancer. I think this person might benefit from an oncoplastic reduction or a lift. And we'll walk in, see them and say, yeah, you know what, let's set them up for a consultation. They're a great candidate for that. So, and again, not just the cosmetic part. It's a nice benefit, but really the key is we try to select people who are going to get a better cancer result as well.
Yeah. Well, you know, I'm just wondering, as far as with you know, a lumpectomy, especially because, you know, I was talking to my mom and that's what she had is a lumpectomy. But, you know, I asked her, you know, did you get any kind of plastic surgery afterwards? And she was just like, you know, no, because I just wanted to get it out. And in fact, she wanted both of them out. They had suggested, no, don't go that extreme. But she was like, I went through so much, I don't want to do more.
Yeah.
So how do you know, and I can understand that. But then, you know, and going forward, especially, you know, she's older, she's like, I'm not going to be wearing a bikini. She wasn't a bikini wearer to begin with. So, but your idea of, you know, when you look in the mirror, you want to see yourself. You know, I mean, it's hard enough to go through the aging process and not see yourself. But you just want to have, you know, kind of shape of a woman. So how do you talk to women to say, you know, it's not a scary process, or it's not, I mean, what are the risks?
Are you referring
to plastic surgery?
Right. So, you know, in a partial mastectomy, you're talking about, you know, extra surgery. Adding a reduction or some sort of oncoplastic surgery doesn't really entail much more surgery. It's relatively straightforward. When you're talking about a mastectomy, it's a completely different set of procedures that we do. The plastic surgery portion is usually the much more complicated portion. But you're right. I mean, people come to us and they're fixated on that diagnosis, as they should be. They're concerned about their life and their health and their safety. We talk to them in this very stressful environment. You know, they're sent to the plastic surgeon. You know, an interesting statistic, you said that your mother didn't talk to anybody, any kind of plastic surgeon. Only about 30% of women who have cancer surgery actually get a consultation with a plastic surgeon in this country, which is a pretty sad statistic. You know, in this day and age, you'd like to think that with the number of plastic surgeons that saturate this country, that every woman who has a breast cancer diagnosis should have the opportunity to talk to one about the options. There aren't going to be options for everybody. There are some people for whom there's not a great procedure for them, but for the vast majority, there's going to be some sort of option, especially after a mastectomy.
And you do have a lot of advancements in reconstruction surgery, right?
Well, we are going to get to all of that. There's so many questions that we have for you. So we're going to come back with you. We'll have more with Dr. Justin West, and you can get more information at breastlink.com.